Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
What is urinary reflux?
Urinary reflux, also known as vesicoureteral reflux or VUR, is a condition when urine goes backwards from the bladder up through the ureters and to the kidney. Typically, it's just a one-way street. It goes from the kidneys down through the ureters to the bladder. But in 1 to 3% of children, it will move in the opposite direction.
What causes VUR?
Ordinarily, the ureters enter the bladder in a very specific location. They travel through the bladder wall, and it's this tunnel through the bladder wall that helps to act as a valve to prevent urine from going backwards up to the kidneys. In children with VUR, the ureters enter the bladder in an abnormal location. That tunnel is shorter and the valve works less effectively.
Are children born with VUR?
Typically, we would say that children are born with vesicoureteral reflux or VUR. Oftentimes, this will naturally resolve on its own as it's being monitored by a pediatric urologist.
How might a parent know if their child has VUR?
Most typically, a child presents to our clinic with a febrile, that is a fever, and a urinary tract infection. That is the first indicator that they may have vesicoureteral reflux. In some children, they may also have abnormalities that have been diagnosed on imaging studies like ultrasounds, MRI, or CT scans. This is another way that we diagnose vesicoureteral reflux. The definitive study for diagnosing reflux is what we call avoiding cystourethrogram, or VCUG. In this study, we would insert a catheter into the child's bladder. We would fill the bladder up with contrast that shows up on an x-ray, and then we would watch that child void while we look for urine going backwards from the bladder to the kidneys.
What are treatment options for VUR?
The treatment options are really dependent upon the specifics of the child's situation. This includes the severity of the reflux, the frequency of infections, as well as the child's age. The options for treatment are both medical and surgical. Initially, we will often just watch this reflux while we have the child on an antibiotic to prevent infections. Sometimes, for severe enough reflux, we will need to intervene with a surgery to fix this. This can either be done in a small procedure that would be done as an outpatient, or may require more extensive reconstruction, in which case we would need to admit the child to the hospital.
Is VUR preventable?
No, VUR is not typically preventable, but it is often related to other dysfunctional conditions with regard to urination or elimination of stool from the rectum. For that reason, we will help children with constipation, and we found that as we address their constipation, very often their vesicoureteral reflux will resolve.